I was diagnosed with simple bipolar. When my diagnosis became apparent, I was crushed because I had grown up in a house where my mother had suffered with it her entire adult life, and I didn't understand it. I was ashamed of it, that couldn't understand why she wasn't always getting better and staying better. And so when here I had the same situation, but I went into the hospital willingly and hoping to get out quickly, but it took a total of 3 months before I was to a position that I could go on an outpatient. When I was hospitalized, we had a 5-year-old son and a 2-year-old, and so my wife was faced with a situation. She didn't know what was going to happen. The psychiatrist did not paint a real pretty picture, that he said it may have to go into a long-term care facility. I did not seem to be responding to the different medications that had been tried up to that point. My wife pushed the issue for them to contact my mother's doctor to see what medications were working best for her. And within 2 weeks, I was able to move from an inpatient to an outpatient. Luckily, I had the insurance and the paid time off from my employer, then I could stay home for another 4 months on an outpatient basis. And then thankfully, my employer took me back and had another 25 years in my career before I retired. I was surrounded by family and friends that did not judge me for my illness. We did keep it very confidential at work, expecting that it could impact my future in a career. I'm happy now that being retired early, I can spend the time doing social services and just the incredible opportunities that NAMI presents. I have a better understanding of the psychology of in mental illness, the genetic mutations, all these things, the rapid improvements that have gone on since I took beginning biology back in the early 70s. But so that was fascinating to learn more and put my past history into perspective.
I have lost 3 family members from suicide, and I have lost a nephew. I was diagnosed with depression in my late 20s, and I did not take medication, and I did have psychotherapy for about 28 years. And I ended up taking medication, and it has been a tremendous help. But I don't have high expectations of getting what I'd like to get done during the day. I have very low expectations. Sometimes it is getting through the day, and other days, I will come out of it. If I don't take my medication, it definitely feel the difference. The most important resiliency skill I have is to get rest, a proper diet, and plan on getting something accomplished during the day. Living with someone with bipolar is my husband, and he is very well maintained. And yet, when I see small glimpses of something that could possibly be a problem, I really struggle with the fear of going through it with him again, though he's done wonderful. I have a son who is diagnosed bipolar, and he is not so well maintained. And having mental illness in your family, it is my illness as well. You know, we share that illness. It's not his illness, and it's not me dealing with his illness. It's our illness. And it's very difficult